One of the most common conditions that we have come into our office is spinal stenosis. So what is spinal stenosis? When we look at the anatomy of the vertebra, specifically the low back, you can see where you have the two individual vertebrae, you have the disc, but then you also have where that spinal column runs. So you have the spinal cord that runs from your brain down through your spine. These are all the bumps that you can feel on your back. So remember, your spine is your suit of armor for that nervous system. So what can happen is when you start to build up degeneration and arthritis, that hole, that spinal canal where the spinal cord runs, starts to get smaller and smaller. So it starts to put pressure directly onto that spinal cord and also those peripheral nerves as well. A lot of times this is detected from an MRI, sometimes even an X-ray as well. When a patient starts to have this, we treat this just like degeneration arthritis when patients come into our office. So what we need to do is get that spine moving properly again. Start taking that pressure off the nerves and prevent further spinal stenosis. I think that's one of the biggest mistakes that people make with spinal stenosis is they think that there's absolutely nothing that they can do for it other than pain pills, surgeries, and injections. With that, it may be able to take the edge off the symptoms or mask the symptoms for a period of time, but in reality, the problem continues to get worse. And the best thing that we can do is help take that pressure off of the spine and really help with the overall health of the vertebra, of the spine, because that's directly correlated to the health of your nervous system. So when you have that pain happening, that's that check engine light coming on in your body. So some ways that we can do to help that and really help take that pressure off the nerves is by doing things like spinal decompression, a specific chiropractic adjustment to help restore motion. We can even do specific therapeutic exercises to help break up scar tissue, adhesive tissue, to really help get that motion back into that spine, because motion is lotion for these joints. So if you start to go through the process of not moving anymore, just avoiding movements that give you trouble, that spinal stenosis typically gets worse a lot quicker than if we help restore that motion and help reduce the pain. So that's spinal stenosis for you. And there is something that you can do for this that's more conventional instead of going towards more invasive types of treatments like injections, surgeries, or pain